There is a jar in your kitchen cupboard right now. You have probably had it for years, and a single teaspoon of it can put a person over the daily safety limit that European food regulators set for one of its compounds. Not a supplement, not a pill, a spice. It is almost certainly the cinnamon in your cupboard. And in the next 20 minutes, I am going to explain exactly why, how to check what you have in about 10 seconds, and what to buy instead. But I am also going to do something else, because I have spent the last few weeks going through the actual clinical trials on the most common kitchen remedies: cinnamon, ginger, cloves, garlic. And what I found genuinely surprised me in both directions. One of them has stronger evidence than I expected. One of them works, but almost nobody uses it the way it was actually tested. And one of them can send you to hospital if you use it the way the internet tells you to. I'm also going to tell you which of these you must stop before surgery. That one has caught patients out, and their surgeons were not told. So let me start with the cinnamon, because I opened with it and I do not believe in making people wait. Here is the problem. There are two completely different plants sold as cinnamon. Cassia cinnamon is what is in almost every grocery store in America. If your jar just says cinnamon, it is cassia. Ceylon cinnamon is a different species, usually labeled clearly, usually more expensive, and often sold as true cinnamon. Now, the difference that matters. Cassia contains a compound called coumarin at roughly 1% by weight. Ceylon contains roughly 0.004%. That is a difference of around 250 times. And coumarin is toxic to the liver in a dose-dependent way. The European Food Safety Authority set a tolerable daily intake of 0.1 milligrams per kilogram of body weight. Let me put that in plain terms. For a person weighing about 150 pounds, that works out to roughly 7 milligrams of coumarin per day. 1 teaspoon of ground cinnamon weighs about 2.8 grams. If that is cassia at typical coumarin concentrations, that single teaspoon can contain somewhere between 7 and 20 milligrams. So 1 teaspoon can meet or exceed the daily limit. 2 teaspoons is well past it. Now, before anyone panics, an occasional sprinkle on your porridge is not going to harm you. The reported liver enzyme rises in case reports involved regular, heavy intake, and they generally resolved after stopping. The people I actually worry about are these. Anyone taking cinnamon capsules daily for blood sugar, because most of those capsules are cassia and the doses are concentrated. Anyone with existing liver disease, hepatitis, or elevated liver enzymes. Anyone drinking cinnamon tea made with heaped spoonfuls twice a day as a health routine. And anyone already taking several medications that the liver has to process. Here is your 10-second check. Go and look at the jar. If the label does not say Ceylon, assume it is cassia. If you use cinnamon occasionally in cooking, carry on, it is fine. If you use it every single day as a health measure, switch to Ceylon. It costs a little more and it removes the problem entirely. Now, the obvious question: does cinnamon even work for blood sugar? The honest answer is modest, and I want to be careful here. Dose-response meta-analyses have found real but small reductions in fasting glucose and in HbA1c in people with type 2 diabetes. The effects are heterogeneous, the trials are small, and the benefit appears strongest in people whose control is already poor, with minimal effect in those closer to target. For comparison, one analysis put the average fasting glucose reduction at around 24 milligrams per deciliter against 50 to 80 or more for metformin. So it is not nothing. But it is not a substitute for treatment, and I have made a whole separate video on why that distinction matters. And here is the interaction worth knowing. Because cinnamon may lower glucose, combining daily high doses with insulin or a sulfonylurea could, in theory, push someone low. If you take diabetes medication and you are also taking cinnamon capsules, that belongs in a conversation with your doctor. Now, number 2 on my list, and this is the one with the strongest evidence of the 4, ginger. An umbrella review published in the American Journal of Clinical Nutrition pooled the evidence across many conditions. Their conclusion was that ginger appears safe and beneficial, with the greatest confidence in three areas: anti-nausea effects, pain relief in osteoarthritis, and glycemic control. Doses of roughly half a gram to 3 grams a day in capsule form, taken for up to 3 months, were consistently reported as effective. Let me take the nausea evidence first, because it is the strongest. A systematic review of 12 randomized trials covering 1,278 pregnant women found ginger significantly alleviated nausea. That is a genuinely solid body of evidence. And a review of chemotherapy trials found that patients taking not more than 1 gram a day for at least 4 days had significantly less acute vomiting, with an odds ratio of 0.3. So if you get car sick, seasick, or queasy from medication, this one has real backing. Now, the joint pain evidence, and here I want to give you the honest version. A meta-analysis of randomized placebo-controlled trials in osteoarthritis found ginger did reduce pain and disability, but the effect size was small, a standardized mean difference of about 0.22. The authors rated their confidence as moderate, and they downgraded the quality of the evidence twice. They also noted that trials with weaker blinding reported much larger effects than well-blinded trials, which is a classic warning sign. So my read is that ginger probably helps knee pain a little. Not as much as the headlines suggest. And now, the part that matters more than any of that. Ginger is an anticoagulant. The authors of that osteoarthritis meta-analysis flagged this specifically. Ginger affects platelet function, and that is directly relevant to anyone on warfarin, a blood thinner, or daily aspirin. They also noted a synergistic effect between ginger and nifedipine on platelet aggregation, and nifedipine is a common blood pressure medication. Their conclusion was that anyone recommending ginger to an older patient has to consider their other medications first. So culinary ginger in your cooking is fine. Ginger capsules at gram-level doses, if you are on a blood thinner, is a conversation with your doctor or pharmacist. Which brings me to the surgery point I promised at the start. If you are having any operation, including dental extractions and cataract surgery, tell your surgeon about every supplement you take and stop bleeding risk supplements roughly 2 weeks beforehand unless told otherwise. Ginger belongs on that list. So does garlic, high-dose fish oil, ginkgo, and concentrated turmeric. Surgeons ask about medications. Patients frequently do not think of a spice capsule as a medication. That gap is where problems happen. Now, number 3, and this is the one where the internet advice is genuinely dangerous. Cloves. Let me start with the good news, because it is real. The active compound is eugenol, which makes up 70 to 90% of clove oil. It works by 2 mechanisms. It reversibly blocks sodium channels in nerve endings in the same broad way local anesthetics do, and it inhibits the enzymes that produce inflammatory prostaglandins. This is not folklore. Eugenol has been used in clinical dentistry since the 1800s, and zinc oxide eugenol is still the basis of temporary fillings and dental cements today. Your dentist may well have put it in your mouth. A randomized trial of 73 adults found clove oil gel performed as well as benzocaine, a pharmaceutical topical anesthetic for dental pain, and both beat placebo. And a systematic review of 21 dental pain studies identified eugenol as having the strongest analgesic properties of all the plant-derived agents they evaluated. So the compound works. Now here is the problem, and it is a big one. Almost nobody uses it the way it was tested. Chewing whole cloves delivers a negligible amount of eugenol to the painful tooth. Clove tea contains trace amounts, far below what produces analgesia. The trials used formulated gels at controlled concentrations, not a clove held against a gum. And applying undiluted clove oil directly to your gum is genuinely harmful. Eugenol is cytotoxic to human cells above about 10% concentration. Neat clove oil on oral tissue causes chemical burns, ulceration, and nerve irritation. I have seen the result of this, and it is worse than the toothache was. If you are going to use it at all, the correct method is dilution. Roughly 1 drop of clove oil in 5 to 8 drops of a food-grade carrier oil like olive oil applied with a cotton bud to the tooth surface, keeping it off the gum as much as possible. And spit it out. Swallowing concentrated clove oil carries a real risk of liver injury, and in significant quantities, it has caused seizures and coma, particularly in children. Never give it to a child. One more thing. The Food and Drug Administration downgraded clove oil from its previous classification for dental pain, citing insufficient evidence for that specific use. And critically, nothing about eugenol treats the underlying problem. It does not reduce bacterial load. It does not fix a cavity, an abscess, or a fracture. A toothache in an older adult that lasts more than a day or two or comes with facial swelling or fever needs a dentist, not a bottle. Dental infections in this age group can spread and become serious. Now, number 4, garlic. Multiple meta-analyses of randomized trials have found garlic preparations lower blood pressure in people with hypertension, with systolic reductions commonly reported in the range of 5 to 9 points. That is a real effect size comparable to some low-dose medications. But 2 honest caveats. Most of that trial evidence used standardized supplements, particularly aged garlic extract, not the clove you chop into dinner. And one recent analysis found the blood pressure effect was clearest in people aged 50 to 60 and less clear above 60, most likely because arterial stiffness at older ages is harder to shift. Garlic in cooking is a good habit. I would not expect it to replace a blood pressure tablet, and it is on the bleeding risk list I mentioned. Now let me give you the ranking, because that is really what this video is about. If I had to order these 4 by the strength of the evidence behind them, it would go like this. Ginger first, for nausea specifically, where the trial evidence is genuinely good. Cloves second, but only as topical eugenol, properly diluted, for short-term dental pain while you wait for an appointment. Garlic third, for blood pressure, with the caveat that the trials use supplements and the effect may be smaller in older adults. And cinnamon fourth, with a modest glucose effect and the only genuine liver safety concern of the group. Notice something about that list. Not one of them is a cure for anything. Every one of them has a medication interaction. And the 2 with the best evidence, ginger and eugenol, both work best in exactly the concentrated standardized forms that the internet tells you to skip in favor of the raw kitchen version. That is the thing I most want you to take away. Natural does not mean weak, and it does not mean safe. If a substance is strong enough to change your blood pressure or numb a nerve, it is strong enough to interact with your medications. 3 honest statements before I close. Most of these trials are small, and several of the meta-analyses I described rated their own confidence as low or moderate. Effect sizes in the real world are almost always smaller than the headline numbers, and this video is education, not medical advice. I am a physician, but I am not your physician. Now, the practical instructions, and there are 4. First, go and look at your cinnamon jar tonight. If it does not say Ceylon and you use it daily, switch. Second, if you take a blood thinner, aspirin, or a diabetes medication, and you are taking any of these as capsules rather than as food, tell your doctor or pharmacist. Not because they will tell you to stop, because they may adjust something and because they cannot account for what they do not know about. Third, if you have surgery coming up, including dental work, hand over a list of everything you take, spices included, at least 2 weeks in advance. And fourth, and this is the easiest one, put every bottle, capsule, and supplement you take into a bag and bring the actual containers to your next appointment, not a list from memory. The bottles. Surveys consistently find that most patients never tell their doctor what supplements they are taking because they do not think of natural products as medicine. Your pharmacist will also run an interaction check for free, and almost nobody uses that service. Let me finish with this. I like that people reach for the kitchen before the pharmacy. Several of these things genuinely work. They cost very little, and that matters when you are on a fixed income. But the same properties that make them useful make them worth respecting. The cinnamon in your cupboard is a good example of both at once, mildly helpful for blood sugar and capable of exceeding a regulatory safety limit in a single teaspoon. Both of those are true, and you would not learn the second one from the jar. So tell me in the comments. Go and check your cinnamon right now and tell me whether it says Ceylon or nothing at all. I would genuinely like to know how many of you have been using cassia daily without knowing there was a difference. And if there is another kitchen remedy you would like me to put through the research, name it below. I read every comment, and the last video I made came directly from one. Take care of yourselves, and I will see you in the next one.